I'm Dr. Lou Bridges. I'm the physician-in-chief at the Hospital for Special Surgery in New York City. I'm also the chair of the Department of Medicine and head of rheumatology at Hospital for Special Surgery, and I serve as head of rheumatology for Weill Cornell Medical College. So my initial foray into rheumatology was in the laboratory. I became very interested in studying at the fundamental level what's going on in the tissue of rheumatoid arthritis, and I studied B lymphocytes. I was very fortunate to have some good mentors. I evolved my program over years to involve genetics of rheumatoid arthritis, and particularly in African Americans with rheumatoid arthritis, who have been traditionally underrepresented in medical research. So that was a very enjoyable time. I built, with my colleagues at multiple institutions, a large cohort of patients and biospecimens that we use to try to characterize rheumatoid arthritis in African Americans at a much finer detail that had ever been done before. I've always been really devoted to A&R since I was a fellow, and it fascinated me to think about writing a paper and having it published and people all over reading it. And I really learned that A&R was the leading journal in rheumatology for basic science, but also included clinical science. And so I was on the Committee on Journal Publications and learned a lot about how the nuts and bolts work for publishing. That made me even more interested, and I became an advisory editor as a junior person. And then I had the really good fortune of serving as a co-editor under Joan Bathon when she was the editor-in-chief. And then subsequently working with Rick Ucala in that same role for a few years. And then when I had a leadership role in the Rheumatology Research Foundation, I had to step away. So I feel like in many ways I'm coming back to my roots. I've always felt a close affinity to A&R, and I think my mother, who was an English teacher, would be very proud that I'm going to be editing a journal from this point forward for the next 5 years. I have several goals as editor of A&R. The first is really to present the most impactful work in ways that researchers, as well as clinical rheumatologists and rheumatology healthcare providers, can understand. Some of the very detailed basic science work, I hope that we can publish things that aren't attractive to other journals necessarily because they may be in rare diseases, or they may appeal only to a certain group of investigators. I think that the focus of always thinking about impact factor is really important, but what's really important is that we publish really good work that's relevant to rheumatic diseases. And some of the work that's being published doesn't have a good journal to put that in that's highly visible, and I wanted to maintain that. I'm very excited to take on this role. The people that I have worked with in the editorial staff and the editorial members, board members in the past have been really extraordinary and really fun to work with, and I'm really looking forward to this as an opportunity to work with my friends and colleagues to do something that's impactful and important.